My name is John Jordan, and I am a family nurse practitioner working at the Norman Regional 9 Clinic in Family Medicine. In this video, we're talking about men's health and why you should seek out or get a primary care provider. Men's health is very important, especially setting aside this time to talk about it, because we tend to brush off our own health. We want to take care of everybody else, and everybody else is taken care of. The problem is that, if you have something that needs to be addressed and it goes on long term, it's going to be hard to pour from an empty cup. And if you're not at your fittest and your healthiest, there's no way you can provide as much as you can or could for you or your family. Having an aversion, or let's say not wanting to go into the doc because I'm never sick, I don't have any problems, my family was all healthy. That could be true. You could be healthy with no problems, but how do you really know unless you come in and get examined by somebody who knows what they're looking for? At least get in for just a general physical to make sure there is not something that needs to be addressed or followed up on. For a brand new patient, I'm going to meet you, I'm going to introduce myself, figure out a little bit about you, and figure out what your concerns are. We'll talk about your family history, anything in your immediate history, and then your concerns. Current screenings right now, you start getting 20, 30. Getting your A1C checked. And A1C is a marker for diabetes. Getting your cholesterol screened is very important as well. A lot of times you don't know you have high cholesterol or you have problems. So it's good to get those things screened early. Around age 45, you'll start thinking about colonoscopies. So that's where we generally start screenings, assuming you're not having any problems. If you have any type of problems, stomach problems, bathroom problems that would require it to be done sooner, then it can absolutely be done sooner. Around age 50, we start screening your prostate. And typically speaking, most of the time you can screen this in the blood work. Catching those things early is paramount. The more time goes on, that it gets exponentially harder to treat, and your chances of long-term quality of life go down. Think about it like a fire. If you see a fire starting to spark and you put it out early, it's easy. You wait 2 hours, that fire has grown out of control. It takes a lot more time, a lot more effort, and it becomes potentially very dangerous to put out. A basic panel, like we talked about, your A1C, your cholesterol, maybe your blood counts, liver function, kidney function. It's one poke, one needle gets everything we need, and we get that all collected in just one stick. It's very efficient, and a lot of those results can be viewed in your patient portal, the minute they come in. And generally what I'll do is if there's a lot of stuff we need to talk about or stuff we need to get some information on, I'll call you myself, or I'll have my nurse call you and set you up for an appointment to come in so we have some definitive time to sit down and go through your lab work. That way I can answer your questions, you can answer my questions, and we have time to develop a good plan of care. There's a lot of small changes that can really make an impact on how you feel about yourself, how you function. One is getting adequate sleep. I think that's one of the biggest ones, is trying to get enough sleep. 7 to 8 hours a night on average. If you can get the 8, then that would be ideal. This running on 2 hours of sleep, maybe when we were 20, it's hard to do now. So getting adequate sleep for one. 2, eating a well-balanced diet, less than 30% fat in most things, red meat once a week, vegetables, drinking enough water. Take your body weight generally, divide it by 2. That's how many ounces you should try to get in a day. Limiting alcohol intake if at all possible. Quitting smoking, e-cigarettes, vaping. I would say getting rid of those things would be ideal. If there's one thing I could say at the end of this all is don't delay achieving a good quality of life. If that all it takes is an office visit and a couple of routine screenings to keep you alive and healthy, because there are people out there that love you and care for you and they want to see you around for a long time. If you're hesitant about coming in or calling or finding a primary care, don't be. Find somebody that you have a good relationship with or feel like you can have a good relationship with. Find somebody that you can trust, and find somebody that you can trust enough with your own health.